Hi, welcome to Your Health with Dr. Christie. Today on Your Health, we're going to talk about COVID-19 disease that started in Wuhan, China in 2019.
So what are the symptoms?
Most common symptoms of the coronavirus.
98% of them had fever.
99% of people that have this illness get fever. It can be a mild fever, 99 degrees or higher.
76% had cough.
Have cough. Other people, 70% have fatigue.
Severe symptoms, such as hypoxia.
Greater than 50% lung involvement. That means they'll start to have infiltrate.
And 55 had shortness of breath.
To respiratory failure. Your organs may start to fail.
The sneezing, runny nose. 100% of the cases there were signs of pneumonia on chest CT. And 29% of these patients developed ARDS.
35% have body aches.
Now, diarrhea could be in up to 16% of the patients, and diarrhea again is one of the symptoms that predisposes you to have a more severe form of the disease if you do have the coronavirus. Now guys, you must have noted that abdominal pain, vomiting, nausea, diarrhea, not nausea but diarrhea, all of these stomach symptoms actually do predispose you to develop a more severe form of the disease. So these things, of course, need to be kept in mind by the regular people as well as by the physicians and the healthcare staff as well. Appetite, you do not feel like eating. You may even lose your sense of taste as well as smell. The symptom that everybody talks about, the dry cough. This gives you dry cough, and this is very typical. And if you've listened to a couple and then you can almost say for certain, hey, this person has the coronavirus, and it is that specific, this dry cough.
If you have a fever and a cough, then you should isolate yourself to prevent transmission to someone else, especially the older population in the United States. You should stay in contact with your doctor over the phone and try to decide if you're someone that may need to go to the emergency room. If you decide that you do need to go to the emergency room because you're experiencing shortness of breath or that dyspnea that I talked about, it's so important to call them before you go, and call your doctor too to make them aware. How long should you isolate yourself after you have these symptoms? Remember, I'm not advising that everyone get checked for COVID-19, so you may not be sure that you've had it or not. But if you have a fever and a cough and fatigue, then we can probably assume that you have COVID-19 or influenza. And I would say that you should isolate yourself 100% for as long as you do not have fever for 72 hours on no medications. So you can't be taking medications to lower your fever and go out. That's not the same as being fever-free without medications for 72 hours. Interestingly enough, in the United Kingdom, they're recommending that people stay completely isolated 7 days after the start of their symptoms, and that's for milder cases, of course. As always, I think one of the most reputable websites for up-to-date information is cdc.gov. There's a lot of misinformation out there, and I want to help reassure rather than continue to cause irrationality and increased fear. So at the end of the day, one thing that I want everyone to take home is that if you have a fever, a mild fever, a cough, and fatigue, you may have COVID-19.